Hi there, it's Robert Redfern and welcome to Naturally Healthy News. Firstly, an apology from me. Last week I reposted a picture of Fauci and Obama with two other people, and the information that accompanied it was completely wrong, or fake as Facebook calls it. I didn't fact check it. I've never fact checked anything because I've never found anything that was fake, but of course, first time. But it did get me into trouble with some of my followers because they had seen the picture before and it wasn't where it said in Wuhan. And Facebook itself has given me grief as well. And this means that only people who share my post with me will be able to see my post for the foreseeable future. So, slapped hand from Facebook. Anyway, it's my first and last offence, I promise, and I will take greater care in future about anything reposting somebody else's post. This week's newsletter is Don't Panic, and it's actually an overview of hindsight, what's happened since the 27th of February. Now, that's a special day because it was our idyllic 50th wedding anniversary when I wrote in my newsletter. Today, on the 27th of February, my wife Anne and I and our dog Rafa are all on vacation celebrating our 50th wedding anniversary at a beach hotel in a tiny village called Morganporth, Cornwall, in England. It's winter here and the sea is wild but beautiful. Anne is my rock and has supported all the things we do in bringing the truth about real healthcare. Next day, the world turned upside down. COVID-19 became famous. But don't panic, because there is good news. I have hindsight of everything that's gone on over the last 18 newsletters that I wrote, and reading thousands of words from around the world and fact-checking what I've been reading. Now, I'm sure this is coronavirus, but albeit a stronger version that's gone before. So it's nothing new under the sun. It may be a slightly more of a problem for those at risk, and at risk I mean unhealthy people, but it's not a problem for healthy people or even at-risk people who are following my health plans. And according to Stanford University's disease prevention chairman, Dr. John Ioannidis, the COVID-19 fertility rate for those under the age of 45 is close to zero. In other words, don't panic. Between the ages of 45 and 70, it's between 0.05 and 0.3. Still don't panic, especially if you're following my plans or living a reasonably healthy lifestyle. And I literally have over 100,000 readers and people that many of them are on my plan. And I have very, very few cases reported to me from them. And they would, I've no doubt, complain to me, rightly so, if my plans were not working, protecting them. An example is a couple in their late 60s, 70s, who are very good friends of ours. And they are at a special risk because they both had serious surgery and both had to take pharma drugs. But they're also following my health plan. And this happened in January before the publicity of coronavirus. They were both really sick for 2 to 3 weeks. And they didn't know what it was. They went to the doctor. The doctor said, I don't know what it was. It could be flu. But they were really ill for that period. In fact, if it happened a month later, they're very lucky they didn't get taken to hospital and put on ventilators as many people did. But they convinced it was, looking at all the symptoms and everything that's gone on, they're convinced it was coronavirus. But these are people that theoretically at serious risk, but they still came through it, looking after themselves at home and taking nutrition. That's the important thing. So my definition of a person following a healthy plan, and you can check yourself on this, is a person that takes D3 because it's shown to reduce the risk of an adverse event from coronavirus by 90%. So it's a massive protectant, even if you're an at-risk person. A person that takes supplements that are missing from the intensively farmed food, and that includes selenium, magnesium, iodine, vitamin C, zinc, and many more. A person that drinks 6 times 500 glasses of water over the day with a quarter teaspoon of baking soda. You must have heard me say this many times. Baking soda is the penny cure. A person that walks for an hour or so every day or exercises. A person that sits normally for no more than 4 to 6 hours maximum per day, and that's a lot more than I do. So, and last but not least, a person that avoids starchy carbs, high sugar foods, high sugar drinks, and high factory processed food. That's not food, that's stuff. Food is vegetables, fruit, nuts, seeds, beans, fish, meat, organic if possible. Anything from a factory is stuff. I do get some emails every week after this, people disagreeing with everything I say, and sometimes I do write if a reply is requested. So, I happily take criticism and I listen to it and think about it. So, to be absolutely clear, the evidence is that both those not on my plan or on my plan, and that it doesn't matter whether you're on the plan or at risk, as long as you are on the plan, you are at much less risk than a person that is not taking nutrients, D3 and all the other things. And I'm not going to change a thing about this because the studies are so clear. Wearing masks will not protect you or anyone else. However, as they're now required, there is a plastic mask I showed last week and put it on Natural Healthy News, which allows airflow coming through. That won't harm you like the material one. So if you're going to have to wear a mask, yes, I know it's terrible and I'm angry, but I don't get angry about things I can't change. I get angry about things I can change. And I can't change that if the law says I've got to do it. And so there is a way around it. It's a plastic mask. It fits over the face, over the mouth and nose, but doesn't block. You can still breathe clearly. You don't get bunged up. No overheating. We saw it actually in a restaurant in Spain, and the waiters were absolutely deliriously happy about it because the ones they had before, they could hardly breathe rushing round the tables. Anyway, anybody that wants to fact check me on the evidence about masks, I've put a post today on my Facebook Natural Healthy News, and so you can read all the facts about it and the studies and the scientific opinion on that. So we've said this is a coronavirus infection. They take place every so often, sometimes to a greater, sometimes to a lesser degree of severity. It might be worse than previous years this year. I can't know. We can only look in a year's time when we see the cause of death. The deaths from all causes. It has to be all causes, and there's a serious reason for that, because they've not been doing post-mortems on this at all. In fact, doctors have been banned all over the world from ordering post-mortems, so they can, and they've been instructed to write COVID-19 on death certificates. Why would anybody demand that doctors do that? Even when doctors protest about it, they're getting sent home or struck off. It's something very seriously wrong going on when doctors are told to fake the cause of death, and they not allowed to do anything about it. So the true death rates of the previous pandemic years, in the last 30 years, they did keep accurate figures, and when it was shown a year later, it was 50% less than the numbers given out during the epidemic. Half as many deaths. And don't get me wrong, people are dying because of the coronavirus, because they're very, very sick, and they're not, they just don't give anybody. I think it's actually, it should be a criminal offence for the doctors and the medical system not to give people D3, vitamin D3. It's not a vitamin, as you know, but we call it vitamin D3 because it's a 90% protectant. Anyway. What can I say? People do die, obviously, and more people die from lung disease and heart disease and hospital-acquired infections. Yes, just going in hospital, pick up an infection, you can die there. 50,000 people, more people than have died from coronavirus every single year die from hospital-acquired infections in the UK. It's called sepsis. Now, has anybody died of sepsis this year? Or you get my point now? Has anybody died of sepsis, or have they all died from coronavirus? And if they didn't, where's that 50,000 people that die every year in British hospitals? Where are their figures? We'll see. Hopefully in a year's time. I don't know what a year's time will look like. There are real dangers, and they're caused by lifestyle, lack of nutrition, and other reversible causes. And if you don't take the nutrition, if you think I'm trying to flog vitamins and minerals, you're wrong. You're seriously wrong. I don't care. I'm 74. I might even be able to retire actually, but I can't retire because how can I turn my back on this? The seasonal infection tipped people over the edge and caused death. But that's because they had no health reserves, no supplements, and were at risk. Now, I said, actually back in early March, why are they not putting at-risk people in hotels around because they closed all the hotels and emptied them. Why aren't they not putting the at-risk people in hotels, giving them vitamins, minerals, and generally looking after them and keeping them safe, actually, and leave the rest of us to carry on working and get out into the world? But no, they don't want that. They want to keep locking people down, keep getting people tighter and tighter under their control. They're still saying that hydroxychloroquine and zinc doesn't work. It's a lie. The studies confirmed it. When a study came out saying it didn't work, even the Guardian newspaper, which is a deep state newspaper, they exposed it as a fake study, and they said the pharmaceutical industry had created this fake studies so that they could denigrate hydroxychloroquine and zinc. It does work. It's worked for, well, I think it's 60 years. So let's not split hairs. I still think we're seeing the biggest planned assault on the history of the world perpetuated by the pharma medical cartel and the central banks, and because it's happening so strongly all over the world. Countries like Sweden, that didn't have a lockdown, they're still attacking them. Recent figures are really good from Sweden. Same in Japan. Japan didn't have a lockdown, and they keep saying, oh, there's a lot more people getting it. Getting coronavirus is not a problem. It's the people at risk that's a problem. So they keep saying there's millions getting coronavirus. So as long as it's not at-risk people, it doesn't matter. As long as they're taking vitamin D, it doesn't matter. But they are absolutely creating this mass terror around the world. And unfortunately, the whole of the media, there's everybody in the media just going along with it. I don't know why, but they are. The WHO, the World Health Organization, sounds a lovely organisation, doesn't it? But it is part of the deep state and the pharma medical cartel. It didn't used to be. I remember reading reports from it 30 years ago when I first came into natural health, and they were working about nutrition then. It's all finished. It's drugs, and more drugs. We have people who lie. The government advisors lie. There's a guy called Neil Ferguson from Imperial College London. He lies. He will say, oh no, I said it may be 500,000 people that die. That's you say a figure, that's what sticks. The word maybe doesn't stick. He intended it to be a lie. He intended to spread terror, and he did. And he's been at the centre of all the propaganda, even though he got actually sacked for a misdemeanour. he's still been at the centre, and he's still being quoted by the BBC and the other media. So in other words, he's not gone away. Imperial College is part of pharma medical cartel. It's a centre for them, and they support the mass vaccination of everyone in the world, and that's where all our information comes from in the UK. The same is in the USA, is the Centre for Disease Control. All the information is coming out of there. It's a front for the pharma cartel, and of course the infamous Dr. Fauci. So what are they doing all this for? I can only presume they're trying to frighten everybody into submission, so they will do exactly what they say. Take the drug, don't take the drug, have the vaccination, don't have the vaccination. The studies going on in vaccinations, just the other day, Oxford University said, we're getting really good results from the vaccination trials that we're doing. And so I read up on it, and it said, well, to begin with, we used to give people a placebo, a saline injection, but so many people were having really bad reactions that were taking the vaccine, and they would know they were having the vaccine, and we didn't want that, so we changed it to a meningitis drug. Now everybody's getting bad reactions. One guy collapsed and had to be taken to hospital. What? This is what they call studies. This is what they call safety studies. And they say, well, it is safe because it's the same side effects as the meningitis drug vaccine. Sorry, they're crazy. Obviously, I'll tell you the best ways when I can find them, how we can avoid having this vaccination. I don't know. You see, there's not enough. I've seen some of the protests in the USA, and I'm in awe of them, because we're just not getting protests in the UK. I just don't know why people are frightened, or I don't know what it is. Really, I don't know. But either way, their plan is to track everybody through mobile phones, as they say, for health reasons. But in other words, they can know what everybody's doing, where they are, where they've been. And I don't actually believe this story about the chips that they're going to inject in vaccines, because I know they've not got the technology yet. But for the foreseeable future, I know enough about technology to know that wouldn't work anyway. So this is just the start. They've softened everybody up, and now we've got to watch what they're doing, and we've got to keep track of what's happening, and prepare for the next 5 years, because I think it's a 5-year plan now to take over everything. And all these riots around the world, I think they're fomented by politicians as another distraction to try to make everybody nervous and frightened. I can't see why the cities in the USA would defund the police, tell the police to go home and leave the streets to rioters. Very strange. Anyway, so in my age group, all I can say to everybody is, if you get healthy and if you need to carry on working to have an income, you need to do it, because we cannot be sure of the incomes with the state of the economies everywhere. So even if it's part-time, and I told you before, if I had to go and sweep the streets, it wouldn't bother me one bit, because I think it's a wonderful thing to help to clean up our country, and I'd be nice and fit and healthy as well with it. But one thing I have to say, stress, anxiety and depression are becoming a problem, and you need to recognise and get in touch with it before it becomes entrenched and you start to freeze up with depression or anxiety. I do have nutritional solutions that work within days, so you need to get in touch with us on that. Follow my plans whenever your finances allow. I'll always make sure it works for you and we can advise you. Read my previous 18 email newsletters if you can, because I ran just the same, so there's no difference. And I know trying to talk to your family and friends about this is a problem. It's no different for me, but you need to talk to them as much as possible about them looking after themselves with they don't even have to believe in it, but we've got the studies, we've got the proof, the scientific proof that just taking D3 improves your risk factors by 90%. Good Health Naturally, Natural Healthy News are not for profits, but we will keep providing support for you as long as funds and the authorities allow us to. And the three nutrients which are absolutely critical are the Active Life. That's got 130 different nutrients in it. Everything that I've actually said, even D3 and vitamin C, which I'm going to mention next. So Active Life is the very basis of good health. I don't think there's anybody got 80 in there, 60, 30, 20. I mean, look at the list of nutrients in your multivitamin and mineral. There's 130 in Active Life. So if you did nothing else, it's got to be Active Life. Cure C, that's our high quality liposomal vitamin C with quercetin, which has also got studies against coronavirus. If you can afford it, then your next step is taking vitamin C with quercetin as well. The next step is taking additional vitamin D3, and there's two there on the list in my newsletter. One is D3 and K2 spray, and the other one is D3. So there's three items. One is got to have it. The next one is really recommended, and the last one is giving you extra. Now, you wouldn't need that if you were going out in the sunshine every day and getting lots of skin exposed to the sun, I have to say, but you certainly would need it in the winter, because that's when all these health problems go crazy. Well, that's it for today, folks. As I say, I apologise again for if you read that last week about the Gates Fauci gang, and believe me, I was, they were not in Wuhan, and my mistake on that. And I'll be here next week. Take care. Bye bye.